Yeah, I'd like to get back to Social Security for a moment. Even though we are living longer, there are a lot of people that are blue-collar workers, electricians,
right.
contractors, truck drivers, you know, you name it.
Right.
A lot of them aren't going to be able to do this type of work at 70, 75. If they raise the age, it'll probably be early retirement at 70 and not full benefits until 75. So we've got to be realistic. There has to be some type of a safety net for these people.
I agree with you completely. And probably what we ought to do is just do a hands test. Look at my hands. I got to work till I'm 70. It's that simple. Dick Durbin, actually, when I was talking to Dick Durbin about it, he said the same exact thing. And you're exactly right. There are blue-collar workers that work hard, physical, excruciating labor, out of the elements for 40 years, 45 years. It is unrealistic and it is wrong to expect them to continue that till they're 70 years old. I agree with you 100%. Those are the sort of things, guess what, that we can work out if we just have the honest conversation.
All right over here, here's a question.
I want to talk about health care. And first I want to thank Mika for being a real champion around childhood obesity, because there are a lot of folks working hard on that issue.
She's a skull.
Feed him, dear. You know, it's really frustrating in a lot of ways to hear. There's been so much mischaracterization around healthcare reform, and I think, you know, we've gotten used to hearing Obamacare, but the bottom line is that Republicans have had a lot of time, decades, to come up with some solutions around healthcare reform, and really nothing happened. And while what's happening now isn't perfect, there are some really important successes, some important movements and milestones. Simply thinking about even some UNH college students who can now stay on their parents' insurance plan. I'm frustrated. You know, my husband and I were fortunate to have 2 full-time jobs for raising 2 small kids. We do okay. We're fortunate. We're okay with taking responsibility for and supporting policies that we know will provide access to health care. And frankly, I'm really tired of hearing Republicans only cite the negative and even mischaracterize it. And I guess I just, I want to know when there haven't been other solutions put forward, you know, what are your thoughts around what is going to finally advance this beyond just mischaracterization?
Well, let me tell you, the biggest problem, in my mind, the biggest problem around the health care reform plan that passed last year is it didn't do the first thing it needed to do, and that is curb the long-term costs. We're still going to be bankrupt. I talked about Medicare and Medicaid. You know what? That really comes down to an underlying problem, and that is health care costs continue to explode. One of the reasons why, and maybe it just has to do with the culture in Washington. We were talking, you asked a question about campaign finance reform. Maybe it's because the first thing the Obama administration did, and maybe they had to do it because they saw that Bill Clinton failed. They called in big pharma. They called in the big hospitals. They protected the trial lawyers. They did things that made sense politically, but didn't make sense economically. Now, I'm not even talking about the Republicans, because you were right. The Republicans didn't put forward a comprehensive plan that would take care of long-term health care reform. But I got to tell you, the biggest problem, and it's a very complicated problem, and we're going to have to get both sides working together on it, is the incentives in health care. The incentives are all screwed up. The incentives are not based on wellness. The incentives are based on running as many tests as humanly possible, running as many MRIs as humanly possible, running as many scans as humanly possible. And Mika, do not worry, I am not going to tell the story.
You better not.
But I was in Massachusetts a couple of years ago.
You don't want to hear it.
I had kidney stones.
They were expensive, okay? No.
Okay, I won't tell the story.
No,
I just said it after I went to the bathroom. I didn't need all the scans. I was fine. But the thing is,
nobody has felt this pain.
Even after I told the doctor I was fine. This is just small, but I've heard this a million times from Americans, and all of it when we've given our speeches. I hear the same thing all the time, and it's that It's gotten to the point where it's not about wellness anymore. It's about profit. And I am a free market guy. I am a small government conservative. I understand that. But the incentives are so skewed to massive profits right now that we have accountants that are running our hospitals. Nothing against accountants. I love accountants. But just like we have accountants running Delta Airlines and other airlines, we've got accountants running hospitals. We've got HMOs making the decisions. We've got insurance companies right now that are making billions and billions of dollars because of the inefficiencies in this system. And the fact of the matter is, this health care reform that was passed only made those health insurance companies even stronger.